Good evening, everybody. Welcome to our webinar. We've had a number of these over the last few months, and it's really great that we're having it when it's nice and sunny. It's not just a mirage behind me, it's actually sunny where I am, and I'm hoping it's nice and sunny where you are. Firstly, welcome to everybody who are joining us on this webinar. 1 year on, exactly a year ago, we were going into the first lockdown, and it's people like you who have been working extremely hard. So once again, thank you from myself and everybody in the council for you to actually do such remarkable work in such challenging times. The way you supported your communities is exemplary, and once again, I really like to say a formal thanks to that. Once again, for you to join this webinar, it's a nice day outside, and for you to take your time out and join us for about an hour, it's really great. Firstly, I think one of the things that we know that the pandemic is not going to go away very soon, and the reason for that is because the nature of the pandemic is such, right? Yeah, that actually will carry on, and the different variations that are coming up every day, which other people have got more knowledge about that than I have. But in terms of where we are, our rates, as you know, were sort of going down, and then suddenly just before Christmas they were starting going up, and after Christmas they shot up everywhere, and we were sort of like on the bottom of the league table, and everybody else is now going down. We're going down as well, but our rates are going down, generally speaking. But I'll talk to you in a minute. But they're not going down as fast as we'd like. Hospital admissions are going down as well, and the number of people who are dying is going down as well. But the bad news is, and I don't really want to give too much bad news, but last week it went up by about 9%, which made us start to think, oh God, right, you sort of go down a couple of weeks and go up. As long as the overall projection is going down, we should be okay, but there's still a lot of work to do. But on a positive, I think, and again, it's hard work of the NHS, the council, the volunteers, and everybody who's involved. 174,000 vaccines have been administered. That is remarkable. If we carry on at that pace, we'll be doing really well. In terms of positive cases, 32,331 cases that we've logged in Kirklees for COVID. Last week we had 469 cases. 98% of them were the Kent variant, which is the one that's quite infectious. So we just need to understand that if 98% of the new cases of the Kent variant, we need to make sure that we actually take the extra precautions that we need to make sure that our rates go down. Talking about rates, we are now 16th in the country. So our rates are 106. We're sort of like in the middle in West Yorkshire. Bradford is at 137 per 100,000. Wakefield is 132 per 100,000. Leeds is 99, and Calderdale is 86. But I'm not really too, because these figures change so often, so we could be the best of West Yorkshire or the worst of West Yorkshire. What I want to do is I want to be the best in the country, right? Yeah, so we've got a long way to go to actually get into the 40s, because I think the national average is sort of like in double figures, in the lower double figures. Like I said, the vaccine is going really well, and we've got a number of centres that have actually started to administer the vaccine since when it started. The one in my neck of the woods is the Al Hima Centre in Batley. Those of you who follow me on social media or the council on social media will know that I took my first dose of AstraZeneca vaccine, and to be honest with you, I was actually quite worried genuinely, because a few days before there were all this going on about blood clots, and I thought, God Almighty, knowing my luck, right? Yeah, I'll probably pull the short straw, and something will go wrong. But when I went in there, I was nervous, I'll be honest with you. But as soon as I lifted my sleeve up, right, yeah, and sat down, yeah, they said that's it, and I said that was quick, because I don't like needles neither, and it was very painless, and I was fine, and I'm still fine, and I feel great. That's the song, isn't it? James Brown, I feel great. Anyway, so basically, the key focus of today is about the vaccines, and if you haven't had the vaccine, the NHS will call you. You will get a text or a letter. And what I would ask you all to do is please do take the vaccine, and do take your turn when it comes. If you are age 50 and over, and you are vulnerable, or you're clinically vulnerable, or you're a frontline worker, you're a social worker, or you're disabled, then if you haven't had a vaccine, please do bring your doctor or get in touch with one of us or the council, or get in touch with somebody, and we'll make sure that you get the vaccine, because you should have already had the vaccines given. On the back of everything that's happening, I'm not going to give you some bad news, because we are doing really, really well, and I don't want to knock everybody who's worked really, really hard. There is work to do. I won't deny that fact, but there is some positive news in terms of what we've been doing. Positive news in terms of there's a lot of people out there who are taking the vaccine, and there is still some work to do regarding people who are hesitating to take the vaccine. It's called vaccine hesitancy, and that's very important that we use that word. So what we need to do is we just need to make sure that we encourage and try and help people to overcome the fears, so we get more people vaccinated, because there are still some people that could get vaccinated, but they've just got some kind of a reservation that we just need to overcome. We've got some great community champions that have coming forward from local organisations. There's been 5 local organisations that have already been registered, and we're working with them. There's 8 in the pipeline, and hopefully them 8 will multiply into more, so we'll get even more champions on that. What we're also doing in the council is giving communities small grants, who can then work with their community to help promote the take-up of the vaccine. There's also the Denby Dale Centre, which will provide transport for people who need transport to go and take the vaccine. Tomorrow, we're going to get our first pop-up clinic in the mosque in Huddersfield. That will be really, really good, because that will encourage people in that particular community to actually go into their local setting, take the vaccine, and B, it will give us a trial in terms of how effective that can be, and then we can start rolling that out in other parts of the borough where we need to do a lot more work. Kirklees College staff are working extremely hard as well. They're training their staff to provide extra guidance for people who need it, especially people who are whose first language is not English, English for speakers of other languages. So hopefully we'll provide some guidance for them to actually get the confidence to come forward and take the vaccine. And we've got some great community support officers who are out there supporting the businesses, providing protective personal equipment packages, because hopefully if we carry on the way we are, which is positive, by the 12th of April there'll be hospitality, outdoor hospitality will be opened. So we need to get our staff to start working with the businesses and whatnot. And from next week, what we'll be doing is we'll get our staff to start going out door knocking to find people who have been isolating, who have tested positive, to actually just provide them with more support. I'm also conscious that Ramadan is due very, very shortly. So there'll be a program of activity that we'll be putting on, which we'll put on our website. I'm sure there's some work that's getting done there. But one of the things that I'm really pleased to announce is Sunrise Radio and the Al Mubarak radio stations are working with us to actually get some messages out over Ramadan, because Ramadan is obviously a very holy month for people who are Muslim background. I myself will be fasting. I need to make sure that we get the right messages out there, because we don't want to put any undue pressure on anybody during Ramadan. Care homes, again, good news story in terms of how they're getting vaccinated, and the care homes that provide dementia services. I'm really pleased that we've had 100% uptake of vaccines, and again, that's only because of the work we've been doing. So I'm nearly finished before I hand over, but I think the key messages from me is that, thank you, and the work you're doing is really, really great. The vaccine, I think that the uptake has been fantastic, but we can do better. We can do a lot better compared to how other vaccines have been taken up. I think it's good news, but because this is such a potent and such a dangerous disease, we need to actually raise our ambitions and goals to actually get more vaccines. Keep your distance when you're going out there. Keep wearing masks. Keep washing your hands, and have that wider awareness around you when you're actually mixing, especially when the restrictions are lifted from the 29th of March and then going to April. Just be aware around you. Anyway, so that's my little bit I wanted to say. If I missed anything, I'm sure Carol and Rachel will pick it up. But what I'll now do is hand over to Carol Patterson, who's my cabinet lead for this part of the world in terms of communities and working with people like yourselves. So, Carol, over to you.
Thank you, Shabir. I'm not sure that you left anything out, but I will reiterate much of what you've actually said to emphasize, I think, the need for vaccination of all people as far as we can, as far as is possible. I mean, we as a council at the moment, we are, as I think you might have said, we've got 100% vaccination take-up of residents in our in-house dementia homes, and certainly we've got nearly 100% in other homes as well. So there's an awful lot of people who have now received the vaccination in the I think, is it 1 to 9 groups and the most vulnerable. And we're also now trying to make sure as a council that people, for instance, who are not so are more hard to reach, like the homeless or people who are not, for whatever reason, not registered with a GP, that we're finding them and making sure that they're receiving the vaccination. But there are still some people, for whatever reason, who are over 50 and who are clinically vulnerable, who haven't yet had that that first vaccination that they're entitled to. And we really, really want to emphasize that it is safe to have the vaccination. It's certainly safer than not having it. We certainly want to encourage everybody who might have been feeling a bit worried over recent press reports or anything else like that, or who have just been thinking, I'll just wait a little bit and see how other people get on, and then perhaps I'll book it. But no, book it if you're over 50 and you are clinically vulnerable. Please book as soon as you can. It's very easy. I mean, Shabir gave you all the ways you can do it, but you can also go online now. You don't have to wait for your doctor to say you're eligible. Just go online, and it's very easy to follow it through. They always say you need your NHS number, but you don't. You just need your date of birth, and you'll find on that online a list of appointment slots. Get one as soon as you can, and then we will all be able to feel a bit more, and I hesitate to say this really, but a bit more relaxed about taking advantage of the restrictions that hopefully will be lifted at the end of this month, in April and then in May. You will feel a lot more comfortable meeting your friends and family outdoors. You will feel a lot more comfortable going to the pub, going to the church, going to the mosque, whatever it is you might want to do to socialize. You, as I say, you will feel far more comfortable in doing that. Yeah, the other thing I just wanted to say about the vaccinations, of course, is that they have actually led to, whilst our infection rate is still far too high for what we would like to see in Kirklees and in West Yorkshire, but it has led to fewer people being hospitalised and fewer deaths. So the vaccination is working. It's making sure that those most susceptible to the virus, if they get it, then it's milder. They're not hospitalised, and so far they're not dying. I mean, and that is the most important thing. We save lives in that way. So to say, I really only wanted to emphasise the things that Shabir has been saying there. So now I'll hand over to Rachel Spencer-Henschel, who will, I think, give you a bit more facts and figures, isn't it, Rachel? Thank you.
Thank you. Yes, thank you. And thank you to Councillor Patterson and to the leader for those introductions. And I guess from my perspective, and I know I've spoken to you a number of times before now, just to reinforce what the leader said about, none of what we've done over the last year could have been achieved in terms of coping with the pandemic without everyone working together. And I think it's been hugely positive and really shows that people in Kirklees do have a sense of the importance of our communities and how we can work together collectively. So again, just to reiterate that thanks on that. I just wanted to cover a few things today, just to build on what's been said already. I think as the leader and Councillor Patterson said, the numbers have increased over the last 7 days, and I think there's a number of reasons for that. I think the first thing to say is that although we went into the third national lockdown on the 4th of January in a better position than a number of areas in the south of the country, and we did see a peak, but it wasn't to the extent that you were seeing in places like Thurrock or Kent, where obviously that variant had originated from. What we haven't seen in Kirklees is quite the expected drop that we would hope to see. So some of those areas that were up at 100 per 100,000, 1,000 per 100,000 at their peak are now at sort of half what we are, which definitely shows the discrepancy in terms of how the vaccine is affecting our different communities. One of the reasons for that we know about is because people in Kirklees and in much of West Yorkshire travel a lot for their work, so they're having to leave the house. And by leaving the house, and being in a workplace where you are automatically going to be close to people not from your household, it does make the social distancing, the public health messages a lot more difficult. And as the leader said, the Kent variant is more transmissible than the variant that we had during the first and second peaks. So that means that for a lot of our businesses, they had really good COVID secure measures, as I know you all did in terms of your faith and community settings. And actually, it's about looking at those again and saying, okay, well, if this virus, this variant is more transmissible than we were expecting, what do we need to do to make doubly sure that those measures are in place? And I'm really pleased by the work that's gone on around the faith settings and some of the community settings that have been open, because actually, you know, we haven't seen outbreaks or anything from those venues, which just is testament to the work that you've all done to make your venues COVID secure. And it is really hard because you cannot stop everybody and account for human behaviour all the time, but it just goes to show that the measures that you've put in place are there, which is really positive. Another reason why the numbers are probably slightly increasing this week is obviously the return of children to schools. So because we've implemented the lateral flow devices, which are the quick 30-minute tests, and I'm sure a number of you that have family who are in schools and are doing that regular testing as part of that family bubble know what I'm talking about. What that does is it will find cases, it actively seeks out cases in a way that we wouldn't normally find out. So up to now, if you've had symptoms and go get a test, that's when you would find out you had COVID. What these lateral flow tests do is they find people who would never have got symptoms in the first place. So we're able to take people out of circulation, if you like, in terms of mixing with others at an earlier point. So we were expecting to see an increase in the number of cases on the back of those lateral flow devices. And hopefully what that does is it prevents that onward transmission because they're able to self-isolate at home. But we're keeping an eye on that in terms of cases that are coming through. I think as the leader and Councillor Patterson said, we're moving through the government's roadmap, and because the roadmap is set out till the 21st of June with sort of 5 weeks between each stages, it's quite helpful so that we can understand the implications from the data of what these changes bring. So on Monday, the changes are actually not very much from a sort of faith and community group setting, but actually do well, not from a faith setting. I think from a community group setting, there is now an opportunity for parents and groups to meet. So there's actually a bit more opportunity for people to meet in a safer way. But predominantly the message from Monday is enabling people to meet in larger groups outdoors. And I think my biggest message today is really getting outside to meet people is so much safer, and we know a lot more about the transmission of COVID now, and we know that ventilation is your friend. So being outside, windows open, doors open, and air going through whatever setting you're in, if you can't be outside, is definitely significant in terms of reducing the impact of COVID and hopefully stopping its transmission. So I think that as we start to reopen through the different stages, it's also, I always think in the back of my head, hands, face, space, and you know, it depends on how you like to remember it, but I do. But also ventilation, because that is definitely the biggest thing in terms of getting that airflow through, and will really, really help that risk of transmission. So I think that, you know, really encouraging people to do things outside more is key going forward. So they were probably the main things I wanted to say, Leader. If it's all right, I'll just check with Wendy and Jane. I haven't missed anything. Have I missed anything? No? Oh, great. So I hope that's all right. Thank you. Right.
Thank you, Carol, and thank you, Rachel, for excellent update. I've got a few questions that have come up, so I'll just read them as they have arrived. The first one is from Rachel Firth. Any advice for churches with Holy Week being next week? Easter's coming, isn't it, next week? Most churches have already made a decision on reopening. So is there any advice that we can give our churches in how they can go about doing that?
So I will bring Wendy in, but I just want to say that I know that a number of faith settings have remained open, and obviously some have chosen to close. So actually, those that have decided to reopen for Holy Week, I guess it's, you know, it's perfectly fine, and certainly the letter that we sent out, which hopefully you'll have received on Thursday, articulated some advice in there that will help to reduce the transmission risk. But I know that Wendy and her colleagues have been working with some venues to offer some support. So Wendy, do you want to come in on what we can do to support people that want to reopen for Easter?
Yeah, so the messages that went out in the letter and the messages that's in the government guidance is, as Rachel said, it's space. So maintain space between people. Look at at your venue and keep numbers to what your venue can accommodate. Lots of ventilation, as Rachel has said, and it's about making sure that vulnerable people are protected, that we are keeping our distances. The government guidance that is available out there is very good, gives lots of advice. The visits that we've made and our teams have made to places of worship have actually shown there's a real high level of understanding of that government guidance and the social distancing measures being carried out. If the way in and way out can be separate, that helps again. Hand washing, all the measures that we've come to learn and know so much more about over the last year will help. But if there's any support or help or advice that you need, we have got officers available. We've increased the numbers of officers that we've got who can offer advice. So if you want to get in touch, then please do, and we can get someone out to come and speak to you at your venue, because that often helps. I don't know, Jane, do you want to add anything?
Just about additional cleaning, Wendy probably would, I would raise as well, ensuring that frequently touched surfaces are cleaned more frequently. And you've touched on the hand hygiene.
Yeah, no, that's very helpful. That's really good. Okay, I've got another question from George Spencer. I'm just going to try and read it out as he's wrote it here. I heard this week that there was a meeting that took place where it was badly organised. how do we get message across that vaccines are halal and safe? So I'll ask Rachel if you want to just, and then I'll then give you my own take on it afterwards.
Yeah. I mean, I have seen a number of reports across the country of meetings being disrupted, which obviously is really, really unhelpful when you're trying to encourage people and give a safe space for people to ask questions about the vaccines. I think obviously the leaders articulated a few things that we're trying to do through, for example, the Community Champions scheme, which is about getting local groups to kind of work on how best to get those messages out. What we understand about vaccine hesitancy, as the leaders described it, which is absolutely spot on, is that there are really different reasons for some people in terms of why they are unsure, and sometimes that can be dealt with by a conversation with a trusted medical professional, so a GP or a local district nurse or somebody that has medical training and qualifications. So I'd always encourage anybody, if you want to have a conversation with somebody, to speak to your GP or a pharmacist or other trusted health professionals. We have a huge amount of resources in terms of the safety of the vaccines and the ingredients within them, and I know that a number of religious groups have published their views and their support of those safety guidelines, so that information is freely available, and we can certainly we've certainly got some of that on our website for people to access if they want to read that information. I think the other thing as well for me is actually over 80% of our older populations have had the vaccine. So actually the amount who aren't having it is quite small. So as the leader said, I think even though there is disproportionate uptake, what we can't necessarily say is that is a significant reduction in certain groups, but also that it isn't just a case of delay. So obviously the different PCNs have rolled out the vaccine programme at different times. So the take-up was never going to be at the same rate and the same level. And some of West Yorkshire was quite ahead compared to some of the rest of the country, and then others are catching up. So I looked at one primary care network, for example, in Dewsbury and Thornhill, whose uptake was about 65%, and then within 7 days it had jumped to over 80%, and it was because they'd started a bit later and then caught up. So I think the first thing to say is that the majority of people are taking the vaccine. Of those that feel like they want questions or they feel unsure, then certainly the conversation with a health professional is definitely the way to go. And what we've also found is community leaders and people in the community that people trust showing themselves having the vaccine or talking about how the vaccine is important. That seems to have an effect as well in terms of showing that social norm. But so I think that obviously disrupting meetings is clearly hugely counterproductive, and it does feel like that's a minority rather than a majority in terms of trying to disrupt some of those things. Leader, do you want to add something from your perspective?
Yeah. In terms of very early doors, there was a debate that was going around regarding A, the safety of vaccines, and B, at the same time, the halal, or is it permissible within the religion of Islam. I'll go on the safety issue first. I think what we need to do, we need to actually follow the science, and this is what I was saying to you right at the beginning. When I took my vaccine, I feel like ages ago, but it wasn't that long ago, about a couple of weeks ago, the story broke out regarding you'll get blood clots in your head and your brain and all the rest of it, and we all know that that could potentially lead to a fatality. No matter who you are. So that really worried me. Now, in my family, I've got a family of medics. So first thing I did was I asked them, and they said, and they've all had it, by the way, because they work frontline workers. They've all had it. They had it some time ago, and they're still around and they're still safe. Thank God for that. But I did get worried. So my son said, "Look, Dad, the evidence is very, very clear, and in terms of the the research and the testing that's done, the clotting of the blood was not a side effect. That's not to say it won't happen in a very small percentage, tiny, well, not even tiny, sort of like a tiniest fraction that that might get it, but that might be due to some other reason. So I'm not medic, but I'm just trying to put some common sense on this. And also, and I don't want to get too political, but the thing came from Europe, didn't it? And in Europe, if you looked at the medical professionals, the scientists, they were saying everything's fine, but there were politicians. I'm a politician myself, but there were politicians, right? Yeah, that were making a lot of noises. And look, this is how I see it. We're in a lot better position than Europe. We've vaccinated a lot more quicker. We probably one of the best countries in the world that's actually took on the vaccine, and I commend the government for doing that, and local authorities and the NHS working so closely, because that matters to us. So that safety aspect, right? Yeah, is paramount. It is paramount. There's been billions put into the front end of that vaccine development, because lives mattered, livelihoods mattered, right? The whole world population mattered on that. So hopefully, right? Yeah, that evidence is there, but we still need to do more around that. And then secondly, the issue around halal, and a lot of the communities who were adversely affected due to the pandemic, in terms of BME communities, especially within the Dewsbury Batley area and some most part of Huddersfield, they've got big BME communities, do come from a Muslim background. And then the debate came about: is it halal? Isn't it halal? Can you take it and the rest of it? Well, all the rulings I've seen are very, very clear. They are halal, and I think the point George is making is, how do we then make sure that we get that message out? And I think we've done a really good job, and the testimony of that is that I found out today that we're going to have a pop-up clinic in Birkby Mosque, which is a Muslim congregation area. I'm sure you all know that, yeah, where the vaccine is going to be administered. So that in itself is so powerful, that shows that actually it's not just a pop clinic, but it's halal, and people will be welcome from all races, all backgrounds, yeah. But it's actually being hosted in the Muslim community. My part of the world, Batley, Boris Johnson came a bit back, and the Al Hikmah Centre is run by the Indian Muslim community, and again, right, the evidence is very, very clear. But I think what we need to do is we need to do a lot more, and I'm sure Joe and Joe will probably and Carol maybe let us know what they're doing, because sometimes I'm not that close to it as leader. But we need to do more work with groups like on this webinar regarding the faith and the community sector. There's role for interfaith to actually develop. I know last year had been difficult in terms of getting that interfaith dialogue going, but there's nothing to stop us facilitating another interfaith dialogue with our clergy from all different backgrounds, imams, and all the other clerical leaders, clergy leaders that are representing the Sikh community, Jewish community, and the Hindu community, and any other community or non-faith communities, to actually facilitate that communication. So we are, I think we're on the front foot on this, but there's always room to do more. I don't know, Carol, do you want to add anything? And then maybe if Joe wants to pick up anything that we might have missed. Carol, you're on mute. You're on mute.
So, sorry, I'll let Joe fill you in on the detail.
Okay.
Joe?
So in terms of the community champion scheme, the question about how do we get people to take up the vaccine, I'm aware of some of the disrupted meetings, but I think the whole purpose of the scheme is based on what we've experienced during the past 12 months and how important and how clear it has been, the power of communities in the voluntary community and faith sector in responding to the next challenge. And it feels like every time we get to the end of one thing, there's another challenge, and everybody has just really stepped up. And so the community champion scheme is built on that. And I think if people don't trust the system, and if people don't want to listen to professionals if they are nervous or haven't had good experiences. The people they trust is people who are around them. That, you know, people in community groups, people in communities, in faith organisations. So I think trusted voices is the key, with good quality information. There's misinformation out there that gets shared so quickly through social media, that I think good quality information from people who are trusted is so important, and faith leaders and community leaders and the voluntary sector are all a part of that. And I think be confident, don't be put off by the very tiny minority who might have that loud voice, because this is about saving people's lives. You know, if they have the vaccine, if they do get that if they do get COVID, they've got a much better chance of fighting it off. So it is a tiny minority that are being disruptive. If there's activities that you want to run, are planning to run, things that you think you could do as part of your daily business, and you need a little bit of extra support, we've got some small grants of up to £1,000. Obviously, we're promoting to do this COVID safe and be secure and risk assess. That's, you know, we wouldn't ever say anything different. But I think I also had my jab around the time the AstraZeneca stuff came out, and how I convinced myself was, if you read any medication, if you read the side effects, it's scary. You know, the little bit of paper you get inside your tablets that you get from the doctor for something. You would never take anything if you read all of that. So for me, the benefit far outweighed that tiny risk. So yeah, I think be brave and don't be put off, because it is about saving lives. And I think all the groups that are coming together to do this, you know, it is a real movement. I think it's fabulous how many people are coming forward and getting vaccinated from all over Kirklees. So we just need to keep that momentum for as long as we can and keep people involved. And yeah, if there's anything, if anyone wants to talk to me about the small grants, then I'm sure the people that are monitoring all the chat will be able to put my contact details in there. But yeah, I would say just keep doing what you're doing, because it's working. So
thank you for that. I've got another question here. Let me just read it out. It's from Mark Umpleby. He asked, we are opening our churches for in-person worship in Batley. Batley is the place to be, by the way. Should we be advising people of a certain age not to attend? And can anybody offer any advice? So Rachel, can I ask you to come in, and then maybe others can join in? Rachel?
Yeah, thank you. I guess just important to know when the churches are opening in terms of any specific advice, because obviously the clinically extremely vulnerable cohort are still expected to shield until the 31st of March, so they oughtn't to be leaving the house anyway. So I would always encourage them to remain at home and shielding. There is no specific advice of an age limit within the guidance. Obviously, there's an encouragement to stream services so that if people choose not to attend a service, they can still experience it, albeit remotely. And I think it links back to the point we made in responses to Rachel's question, which is, you know, we're on hand to talk through your specific situations, and we can help you run those services in the safest way possible. But there is no, I think the difficulty with the age at the moment is that you've got a significant proportion of the people who are most vulnerable in terms of COVID should have had their vaccination by now, and ideally for particularly the very older age group will have had their second dose or be about to get their second dose. So the protection that affords them obviously changes things in one sense. So obviously that isn't a reason not to follow the guidance in terms of hands, face, space or the ventilation, but I don't think it precludes people of any age. I think it's just those that are encouraged to shield at the moment. It definitely should shield until the beginning of April, and then I guess it's for them to think about their own personal risk assessment and how comfortable they would feel. I personally feel quite worried about the kind of well-being of people that have shielded for so long in terms of how ready they feel to re-enter some level of normal society, and I think that will be a big challenge, and certainly part of our work is going to be about how we're supporting those with their mental and physical well-being, because I suspect a year of shielding will have taken its toll on them. I think if it's all right, Leader, I'll just say, and I didn't say this at the beginning. I think, you know, age is by far the biggest indicator of having significantly poor outcomes from COVID, which is why why the National Joint Committee on Vaccinations and Immunisations are focusing on doing it by age group. But obviously there are clinically extremely vulnerable who should be getting their vaccine, clinically vulnerable, and obviously that's slightly more complicated because it will depend on your GP's assessment of your risk factors in terms of whether you're in that cohort 9. And also carers, if you're an informal carer, and you can book if you're an informal carer on the national site. And I think, as Councillor Patterson was saying, getting it booked means you get a lot more choice in terms of making sure you've got access to your appointments. And just one last thing, Joe was talking about the community champions work. I'm really keen as well, if you get any intelligence about people wanting to wait for the vaccine at home. I've had some indications that a number of people have said no to an appointment because they are waiting for it to be given to them at home. I don't know if this is correct or whether this is just anecdotal. So if anybody's heard that, I'd appreciate you letting me know, because we need to think about how we would respond to that in terms of whether that is feasible or practical, or whether actually there's a conversation needed. I'll shut up now, Leader. I did go on 3 things. Jane, Wendy, did I miss anything about the age in terms of the question from Mark about coming to? No. Okay, good.
No, okay. Thank you, Rachel. I've got another question here from Michael Reed. Some months ago, it was suggested that groups might be able to have a church service outside in the spring with singing. When within the government roadmap might this happen? So can we have outside services with singing, and is that part of the government roadmap?
Do you want me to answer that one?
Yes, Wendy, yeah, over to you.
So we've all missed singing, haven't we? We've all missed. There's lots of things I've missed. I've missed singing, I've missed dancing, and I've missed hugging. So when we can do all those things, it will be a real joyous day for all of us. So services outside are encouraged, and it is something that you can do. The weather is helping us in relation to that. Again, whenever people are coming together, then it's that social distancing, making sure that you're keeping sufficient gaps between groups who don't normally meet. In relation to singing, the issue with singing is the droplets and the increased potential for spread. So at the minute, singing unfortunately is not encouraged. On the government roadmap, they are looking at when outdoor entertainment can take place and indoor in relation to theatres and things like that. There's nothing in the roadmap for it happening any sooner than the 17th of May. I think that's the date, Jane, as when they will be looking at it. So singing at the minute, if it is part of the service, then what the suggestion is that it is done by one person and if possible behind a screen. So that time when we can all sing together will be a joyous day, but we're not just quite there yet, I don't think. Is that right, Jane? Have we missed anything?
No, that's correct, Wendy. Presently avoid congregational singing, and obviously one person can sing, but preferably behind a perspex screen.
Yeah,
it's probably sorry.
Rachel.
I was just going to say it's probably worth saying that this is the guidance as is at the moment. We have, and I'm sure you'll all be aware that sometimes guidance changes sort of a little bit and takes us by surprise. So it's always worth keeping an eye on what comes out from nationally, but it would have to be a national change to guidance for that to be any different.
Yeah, somebody's put on the chat, I don't know if you can see on the public platform, But singing outdoors isn't allowed at the moment, but things may change on Monday, because obviously it's going to be announced Monday, the next milestone in terms of the roadmap to easing restrictions. And I can't wait to be honest with you, because at least I'll be able to see somebody in the garden, you know, while it's nice and hot. Well, it's hot at the moment. But I think the thing for me in terms of that excellent question is the sooner we can get everybody vaccinated, the sooner we can get the figures down, the sooner we can, you know, get back to normal in terms of all the indicators, the better for everybody. Because what I miss is talking to people, you know, that's just that one-to-one. Because the officers that you can see on the screen, we usually see each other nearly every day, but I've not seen any of them. You know, my own cabinet member Carol, right? Yeah, we see each other every day, and I don't think I've seen Carol either. And you know, he was only last week. I went into Batley after what, 12 months, 11 months, and the only reason I had to go because I couldn't do what I wanted to do online, and because it was something I had to post. I had to go into Batley Town Centre to the post office to actually get it all posted. And it was so good just getting out and you know, seeing people and seeing the postmaster, and I think that's so important. But I think you know, the other spiritual stuff that we enjoy, you know, in all religions, you know, chanting, singing, listening to prayers, you know, it's so important as part of our well-being, and it's only once we get the vaccines administered, everybody's getting vaccinated, we get the infection rates really low, we then make sure that the hospital admissions stay to a minimum, yeah, that we'll be able to do what we took for granted 12 months ago. And I really look forward to actually, and many of you on this call, I know you all quite well, you know, from the audience point of view, so it'd be great to catch up with you guys, because you know, one thing I've missed is that human interaction is so important. Anyway, so let's just have a quick look. Have I got any more questions? Yeah. Yeah, I've got another question from Rachel. It's a comment actually. There have been rumours that the government may allow distance outdoor singing just for Easter Day. So Rachel, Wendy, Joan, anybody know about that?
I think the difficulty with this is there are quite a number of rumours about things that may or may not change, and obviously we have been and known situations where things have changed at the last minute, and often, unfortunately, we don't get very much notice about it, and so obviously as we'll keep an eye on our connections into, you know, national government as best we can, and I think I've got a call, the regular call with the Chief Medical Officer this week, so it might get mentioned there, and obviously as soon as we know anything official we can let you know, but I don't know at the moment whether that is the case, and I suspect there'll be discussions going on about what is and isn't correct. I mean, from my perspective, I think it's a real challenging one, because certainly what we've learned about the virus over the last 12 months is how being outside is so much more safer, as I said at the beginning. So, you know, it feels like a smaller risk, but again, it's trying to work out what's in the legislation as well, which is often slightly different to the guidance in terms of what is the actual expected rules in that you can and can't do. But let's keep an eye on it. I mean, you know, hopefully we'll find out so that it gives enough time to plan one way or the other, because if there is a change of guidance and you can encourage distance outdoor singing, obviously we'd be keen to work with you on how to make that as safe as possible. But obviously it's the more notice we get, the better, I think, in that circumstance.
Thank you, Rachel. I've got another question that's just flashed up. Is once I get vaccinated, is that it? Can I just go about my normal business? Yeah.
Unfortunately not. And I hope you haven't, Leader. I know you haven't really.
I've got something, you know, me. But I think it's just worth reminding people that just because we all get vaccinated, right, doesn't mean to say that we great stuff, like we can do what we want. Yeah, And
Yeah.
just explain why that is so important, because the variant and all the rest of it.
Yeah, so and you know, I think as the leader said, you know, he's had his vaccine and clearly, you know, has barely been out in terms of sort of putting you know, going back to normal into and that's really, really important that we all remember that and follow that advice. So the thing about vaccines is that what the vaccine will do is it will create an immune response in you, so that if you do catch COVID, your body is significantly better at fighting it off. What it doesn't stop is you catching COVID. No vaccine prevents a disease from infecting you, but if you hadn't been vaccinated, you could catch it, become seriously ill and potentially die. Or if you've had your vaccine, you could catch it and actually suffer either very little or no effects whatsoever. The difficulty is that you could still catch it and pass it on to someone else. So it doesn't stop you transmitting COVID from you to another person. So there will still be people like me, actually, who hasn't had their vaccine yet, because I'm not in the any of the cohorts. And so I could catch it from a vaccinated person and become ill because I'm not protected. So the reason for starting and going down the ages is to ensure the people that are more likely to be ill are protected first. But it's only when we've got what we call population immunity that actually people will be able to not socially distance and wear face coverings. I would always advocate for good hand hygiene, because frankly that works for every infectious disease that we know about, and there's a reason why our norovirus and sickness and diarrhea rates have gone down, and I think it's because people are much better with their hand hygiene. So I think it's just really important that although it protects you as an individual, we still don't know yet the impact on whether it makes you transmit it less or what, but so we have to assume you can still transmit it. So until we have vaccinated as many people in the population as possible, we still have to follow the hands face space.
Thank you, Rachel. Just another question just has popped up on my phone. So okay, so if everybody in the country gets vaccinated, so I accept your point that one individual getting vaccinated, you can't go about doing normal business. But if everybody gets vaccinated, we hit that magic number in terms of whatever percentage, can we all then get back to normal?
I think it's a really interesting question, and I kind of wish I knew the definitive answer, but unfortunately I don't. I mean, I don't think that we're talking about the sort of disease where we will eradicate it. So we've not really eradicated any infectious diseases with the exception of smallpox. Eradication of a disease is really, really challenging. And of course, diseases don't obey boundaries in terms of countries. So you're talking about global immunisation, and that's a hell of a long way off in terms of people getting it across the world, because obviously as soon as people travel, we do travel much more freely now. Nothing is very contained anymore. I think it will be, if we've got the vaccine schedule right, and it will be probably a repeated frequency of vaccines, a bit like the flu. And if we know what level of immunisation of the population creates the herd immunity, so if you've got that information, I think then it will be what would be a reasonable endemic, which is just the name for the level of the infection in the population. And if it's not putting that pressure on our NHS and it's not killing or seriously injuring us, I think that we will go back to a level of normality, but there will be an expectation that those vaccines are taken on a regular basis in order to keep protection. And as you said, Leader, quite rightly, it's about the variants as well, because the variants are the risk. Because if a variant has a particular protein spike on it, then the vaccine might be less effective. So it's managing that, which is quite important, I think. So I don't have a crystal ball, sadly, and I think that the ambition is to get to as much of normality as possible, and I guess that's probably the best estimate at this point, but I still think there's a lot we need to learn about the impact of the vaccination programme.
Another question has just come up from SM. Has the council got any plans to support, promote holding of Eid prayers in outdoor venues such as fields, parks, to help ease the pressure on mosques? Rachel, do you want to answer that, please?
Yeah, so as I said, what we've known now from last year is that being outside is considerably safer. So what we are trying to do is support anyone that wants to do that kind of activity to work with us on their risk assessments so that we can make sure that they're done safely. But clearly being outside is safer than being inside, and we know that now because we understand more about how COVID is transmitted. So I'm really keen on definitely providing that support to organisations that want to do that, so that we can make sure that we use our expertise for managing COVID outbreaks for the last 12 months, looking at Wendy and Jane, that we can really help to make them as safe as possible. Yeah. So that's positive news in terms of allowing that to happen as we move forward, which is really, really good. And if anybody's interested, please contact the council officers and they'll help facilitate that with your risk assessments. Just something that came into my head, Rachel, when you talked about smallpox. Am I right in saying that smallpox was the only vaccination programme which was mandatory by law, that you had to take the vaccine? Am I right in saying that? Does anybody know? I think it was, Jane, wasn't it? I'm looking at Jane. Yeah. I'm pretty sure it was. Yeah. It's just that, you know, if you eradicated it completely, is it because it was mandatory? And I don't know. I don't know if you know the answer, but it's just interesting to understand that, you know. I think it's because of the way that smallpox is transmitted, and again, Jane's more of an expert on this than me, but smallpox is highly contagious. It was highly contagious as an illness, and it wasn't as, so you had to be quite close and in quite a lot of contact with someone in order to catch it, and that means it's easier to eradicate than a disease like COVID or flu or colds, because they exist quite well in the atmosphere, and actually you don't need to be that close to people to catch it. So in a way, the type of disease can make it easier to eradicate than those that are, you know, like it's airborne, it's on surfaces. So COVID is it's well adapted in terms of making sure it survives and gets passed on, whereas smallpox was slightly different in the way it infected people. Is that right, Jane? I think I've got that right. Yeah.
And they used to actually do vaccines. Well, started vaccinating from 1948.
1948, right.
Yeah.
Okay. I'm just conscious we've got 3 minutes left. I've got one more question that's popped up on my phone, so hopefully it could be an easy or a short answer. But what if I only get one jab? Am I okay? So you gotta have 2 jabs, didn't I had a jab. Definitely 2. And then so if I just have one jab and say, oh, forget it, I've had mine. Am I okay? Well, the issue is that what that will give you is a level of protection. But what they know, and through all the clinical trials that they've run, that it's 2 doses, and it's a good 3 weeks after your second dose that you should have reached the maximum immunity afforded by that vaccine. So absolutely encourage everyone to get their second jab, and obviously still maintain the hands, face and space until that and after, just to protect others as well as yourself. Right, thank you, Rachel. Okay, so that nearly brings us to the end. We've got about 1.5 minutes left, and that just gives me enough time to just say once again, thank you very much for taking the time out to join the webinar. And we've had a good attendance. But just to remind everybody who's listening that this will go on the YouTube channel, and in the past I've got some figures in terms of how many views we've had. from the public, and we're talking about thousands. So I hope that we'll get more people watching the previous webinars and also this one, and just let your friends and family and colleagues and congregation know that they can log in and have a look at this at their own leisure when they've got time, because the more people that can see the questions that have come out and the information that's come out, the better informed our public will be, and the safer everybody will be. So once again, I'd like to thank you and all your congregations, all your communities, all your membership for all the hard work you continue to do. It's taught me one thing, that people matter. People really do matter, and if it wasn't for that human connection, be like this, it would have been more difficult. We just need to make sure that we keep on maintaining our space, we keep covering our faces, and keep washing our hands, get that message out there. And hopefully we'll have a webinar, which is, we'll have a meeting which is not on webinar or Zoom or Teams, and we'll see each other and hug each other. I can't wait for that day. So once again, thank you all. Thanks, Carol, Wendy, Rachel, Joe, and Jane. And also we've got a few officers who have been working in the background. You can't see them. Ben, Mashuda, Noreen, and Olivia, because without their support in the background, it would be very difficult for us to organise this webinar. So I thank you all, and good night and God bless. Thank you.